Hello, yes, good morning. Yes, I'm so pleased and I'm so very glad to present my review article based on dementia care in family and community, building resilience and hope. This is the theme of the paper, and I am presenting for International Conference on Social Work and Social Sciences that is held by Sri Research Institute. Okay, so first of all, I would like to give my introduction that my name is Gautam Makwana and I am a research scholar for Ph.D. in social work, and my research supervisor is Professor H. Elizabeth. He is associate professor in Mizoram University, and we are working together for this paper, and I was instructed and guided by her supervision for preparing this paper. Myself, I am a registered geriatric health carer from South America, from the Ministry of Public Health and as well as from the Ministry of Education, and I am pursuing my PhD in India right now. And today is 15th of March, and this is for my presentation. So let's begin that. I first said that I'm a South American citizen as well as from holding a dual nationality. So let's see with the first introduction page. So this is the dementia care in family and community, and that is with C, that to building resilience and hope. So this means that here with C. So with the introduction part, we see that what is dementia. Dementia is a broad word describing a loss of capacity to recall, think, or make it judgment that make it difficult to carry out daily tasks. The most frequent type of dementia is Alzheimer disease. Dementia is not a normal aspect of aging, even though it predominantly affects seniors. Dementia is a common public health problem worldwide. Approximately 47 million people have dementia, and this number is expected to increase to 131 million by 2050. So, what kind of the symptoms are available with C? That dementia in dementia, difficulty with everyday task, especially with repetition, communication problems, getting lost, personality changes, and confusing about the time and place, troubling behavior. And the causes of dementia, we see that damage to brain cells cause dementia. Ability of brain cells to communicate with one another is harmed as a result of this damage. When brain cells can't interact properly, it might impact one's thinking, behavior, and feelings. Types of dementia and stages. Alzheimer's disease, this is the most common cause of dementia. Vascular dementia, this type of dementia is caused by damage to the vessels that supply blood to your brain. So another type of dementia we see with Lewy body dementia, frontotemporal dementia, mixed dementia. There are the three stages we can consider for the dementia, for like a first with early, second with middle, and third with late. So I'm moving with the third slide, please. So diagnosis, regarding in this slide we can discuss about two diagnosis: cognitive and neuropsychological test. Okay, so how can we diagnose? There are the many certain ways in a medical that how we can diagnose with the dementia. So mental capacity will be assessed by doctors. Memory, orientation, logic, and judgment, as well as language skill and attention, are all assessed using a variety of tests. With neurological evaluation, memory, language, visual perception, attention, problem solving, movement, senses, balance, reflexes, and other areas are all assessed by the doctor. So the doctor will go with the take to the patient for certain examination, that is regarding with the neurological evaluation by, and the brain scans, with MRI or CT scan, with examining by MRI CT scan. This can be these scans can detect sign of a stroke, hemorrhage, and a tumor, or hydrocephalus PET scan, a type of X-ray that is used. This can reveal a patterns of brain activity as well as a whether uh, amyloid or to a protein, both of which markers of Alzheimer's disease has accumulated in the brain. Laboratory test. There are another examination from the medical background. See, physical disorder that can impact brain function, such as vitamin B12 insufficiency or an underactive thyroid gland, can be detected with a simple blood test. Infection, inflammation, and sign of a various degenerative disorder are sometimes looked for in the spinal fluids. And with the psychiatric evaluation, these are the the how to diagnose a dementia that has been explained with elaborating with psychiatric evaluation. A mental health expert can assess whether your symptoms are caused by depression or other mental health problems. Here we understanding dementia at the medical concept treatment, the medication. With the medication, there are the the two most drugs that have been treated for using for mostly for the dementia as a patient, with choline steroids inhibitors, and second is memantine. Third, with there are certain medication that helps to prolong or delaying with the the about the period for the dementia, the medication. And the therapies, we go with occupational therapies, second with modifying the environment, and third with simplifying the task. These are the therapies that we can go with. Occupational therapies, as well as the occupational therapists will assist a patient to engage in activities with brain activities. There are the certain types of the occupational therapy activities are available. With the lifestyle and home remedies, we see that at the concept that alternative medicine, for example art, music, aroma, and massage therapy. And see, with coping and support that can be given with the caregiver, with the care and support by family or individual. More the family members are the caregiver for the dementia patient, as well as so we depend on the patient. That such in many countries, as well as in India, that we used to hire a caregiver for our family in order to take care for the patient. And here, carrying dementia in family and community, the what is the role of the family? The impact the impact of family carers or people living with dementia on caregivers health and well-being. Family caregiving is more intensive, complex, and long-term than it has been in the past, and carers are rarely well prepared for their roles. With the role of the community, what can be the the community role that can be used for prevention and treating dementia. Let's see, with the delicate balance between cost efficiency and user preference, as well as safety and independence, is the emphasis of community care. The wishes of older individual with dementia to receive care in their own homes should be prioritized in care planning and reflected in all policies. The preference of informal carers, most of whom are mostly the patient like are women, are essential. Their support requirement and well-being play a large role in the indirect cost of community care. In fact, caring for people with early to moderate dementia at home is less expensive than institutional care. However, this may be changed as disease developed. Care at home may be necessary at some point during the disease progression. So, however, the disease progression can be delayed through the medication, and it can be surely help for the patient, depend on the the degree of and the stages of dementia. Here, this with this slide, fostering resilience in the dementia, the ability to adapt well in the face of severe causes of stress such as Alzheimer's disease, pathology, other neurodegenerative disorder, or biological agent is known as brain resilience. The resilience in dementia thematics series consists of nine article that this is a review article that I have been prepared with under the supervision from my research guide that to cover a wide range of topics including concept related to resilience, brain reserve, cognitive reserve, and brain maintenance, underlying mechanism, a left frontal cortex functional connectivity, and disease trajectories, for example, like rates of the progression to dementia. Here, fostering hope in dementia, that what kind of we can treat for hope, for keeping a hope in dementia, when trying to retain a sense of normalcy and establishing cognitive, social, and behavior methods to increase confidence in early stage dementia. Hope is essential. Maintaining hope, assisting others, and being part of supportive social network can all have help with daily adaptivity and self-concept preservation. The literature was studied using Walker and Evans concept analysis method to investigate hope in early stage dementia and to uncover the dynamics and component of the hope experience. That how this is have been discussed with hope and resilience in care for fostering hope and dementia. And this is the these are the objectives of the study. This study came up with definitions for resilience and hope, as well as to figure out what element contribute to people's resilience and how resilience influence their relationship and well-being. These studies will look into the notion of resilience and hope in dementia for both care recipient and the caregiver, as well as the dynamics and component of their hope experiences. This article intended to provide therapy and knowledge of resilience and hope between individuals with dementia living in family and community by reviewing resilience among family members and friends, supporting and caring for person living with dementia, as how tenacious family caregivers and friends may be when it comes to supporting and caring for someone with dementia. This has been discussed that however for the they need to be get a very emotional and psychosocial support can be given with the caregivers with family members. It is comprehensive literature review on resilience in dementia patient and caregiver with the goal of better understanding the factor that promote resilience and hope, as well as the extent to which viewpoint is maintained. Yeah, with conclusion of in a ending of this slide, that the studies suggest that the people with dementia and their caregivers use resources to maintain their resilience and hope. However, this perspective has been overlooked in previous studies. There are many articles that I gone through with certain research have been conducted, especially with the dementia, that positive relationship between the social support and resilience, as well as community integration and resource utilization, were discovered and investigated, considering the greater body of literature as well as their implication for future research. The existing evidence on the influence of resilience and hope on family caregiver of people living with dementia is compiled in this comprehensive study. And these are the references with slides, and I really appreciated you all of you that you gave me a good time, and I am so pleased to present my slides here with you. And I am so thankful for giving a good chance for presenting my slides here with you, and hope we will meet in a next session from this Sri Research Institute by next by organizing a new webinar or international conference. And I will be very glad to have my presenting slide. So thank you very much, and I am so grateful and I'm having a very gratitude for all listener that given me a time for hearing my slides and presentation. Thank you very much. And my detailed paper for article review is submitted to the conference, and please get a copy if you require. Thank you very much. Muchas gracias. Thank you very much.